You're watching NorthState Health, the North State's first local health program.
Dr. Schwartz, one of your particular areas of expertise is knee surgery. Tell us a little bit about that.
Well, as you know, the knee is the largest joint in the body, and it is very prone to injury throughout our life. We have difficulties with this joint as youngsters and as adults both.
Okay, now who is the most prone to having problems with their knees?
In younger folks, we have a lot of athletic injuries in the knee. Women tend to have more knee injuries than men, and as we age, we get into difficulties with joint replacement surgery because of arthritic conditions of the knee.
Okay, we saw who are the most prone to it. Who are the most, or what are the most common problems that people do have with their knees? And I believe we have a graphic for that as well.
Yes. Well, in athletes, we have meniscal injuries and damage to the cartilage surface, which generates wear and tear in the knee, and also problems with the patella.
All right, let's start talking right off the bat, reconstruction for younger adults. I guess there is a difference between when you have to treat an adult and then someone who may be a little older.
Yes, well, I brought along a model of the knee, and this shows the joint surface cartilage of the knee, the meniscus, and ligaments of the knee. And in younger athletes, we are often doing biologic reconstruction of both the ligaments and the meniscus, and we have some techniques for replacing joint surface cartilage for focal joint surface injuries in a young athlete.
Okay, for a young athlete, one question that I have looking at that, when you deal with a younger athlete, would it be more of like an injury, like a sports injury, and when it's a elderly person or somebody more advanced in age, it's more wear and tear, or?
That's a good generalization, although we see a significant number of athletic injuries in older people now, people in their 50s and 60s and 70s still continuing with athletics, running and exercise do sometimes get athletic injuries as well. However, for the most part, when we get into our 70s and 80s, we're dealing mostly with degenerative problems and reconstructive surgery.
Okay, you were also going to talk about replacements for older adults. There's a difference, and you have some examples of that.
There is, and one of the things that we're quite proud of is our technology and expertise with knee replacement surgery. This is an example of an artificial knee joint. As you can see, it's a metal and plastic reconstruction, and getting a good success with this requires good technique in surgical implantation, requires good rehab on the part of the patient. But one of the things that we do is we use computer navigation, and I brought along an example of this. We basically set up a miniature GPS array on the field, and this device, compared with a computer, allows us to precisely position the knee joint so that we get optimum function and optimum longevity of that joint replacement.
You're watching NorthState Health, the North State's first local health program.